Do you know what Losartan is used for? It's a medication that's commonly used in the treatment of high blood pressure in both adults and children over the tender age of 6. But that's not all it does. Losartan also steps up to the plate in reducing the risk of stroke, especially in individuals who are living with high blood pressure and a condition known as left ventricular hypertrophy. But wait, there's more. Losartan is also a go-to for treating kidney disease in people who have type 2 diabetes and high blood pressure. Now you may be wondering, what makes Losartan so versatile? Well, it belongs to a class of medications known as angiotensin II receptor antagonists. This class of drugs has a specific way of working that makes them particularly effective for these conditions. Intrigued? Stick around to learn more about how Losartan works. Ever wondered how Losartan works in your body? To understand this, we first need to talk about a hormone called angiotensin II. You see, angiotensin II is a bit like a troublemaker in our bodies. It does a few things that can cause problems, especially for those with high blood pressure. Firstly, it causes blood vessels to constrict or tighten. This makes the pathway for blood to flow narrower, which in turn increases the pressure within the vessels. It's a bit like turning a wide river into a narrow stream. The water has to move faster and with more force to get through. Secondly, angiotensin II stimulates the release of a substance called aldosterone. This substance tells your kidneys to hold on to more salt and water, which increases the volume of blood in your body. Again, this increases the pressure within your blood vessels. This is where Losartan steps in. It belongs to a group of medications called angiotensin II receptor antagonists. Think of Losartan as a kind of bouncer at a club. It blocks angiotensin II from attaching to its receptors in your blood vessels. This means angiotensin II can't do its job of tightening your blood vessels or releasing aldosterone. The result? Your blood vessels remain more relaxed and open, allowing blood to flow more easily. The amount of salt and water your kidneys hold onto is also reduced, decreasing the volume of blood in your body. Both of these actions help to reduce your blood pressure. It's important to remember that Losartan doesn't cure high blood pressure, but by blocking the actions of angiotensin II, it helps to control it, allowing your heart to pump blood more efficiently around your body. Now that we know how Losartan works, let's explore its uses. Losartan isn't just for high blood pressure. It's a multi-talented medication that wears many hats in the healthcare world. For starters, Losartan is a go-to for managing high blood pressure in adults and children over the age of 6. By keeping the blood pressure levels in check, it helps in maintaining a healthy, smooth, and steady flow of blood throughout the body. But that's not all. Losartan also rolls up its sleeves to reduce the risk of stroke in individuals who have high blood pressure and a condition known as left ventricular hypertrophy. This condition is characterized by the thickening of the walls of the heart's main pumping chamber. So, Losartan steps in to ensure that these individuals have a fighting chance against the risk of stroke. Now let's talk about another one of Losartan's roles. It's a helping hand for people with type 2 diabetes who also have high blood pressure. In this case, Losartan is used to treat kidney disease. It's an unfortunate fact that kidney disease can be a common complication of diabetes. But with Losartan, the progression of this condition can be slowed down, offering a glimmer of hope for those affected. Losartan belongs to a class of medications called angiotensin II receptor antagonists. These work by blocking certain natural substances that tighten the blood vessels. This in turn helps to relax and widen the blood vessels, allowing blood to flow more easily. But like all medications, Losartan comes with its share of side effects. While Losartan can be beneficial, it's essential to be aware of its side effects. This medication, like any other, can cause some discomfort, so let's delve into what you might experience. Firstly, dizziness is a common side effect of Losartan. This might feel like a light-headed sensation, or you could feel slightly off balance. In most cases, this is mild and will pass as your body adjusts to the medication. Losartan can also lead to low blood pressure. This might sound like a good thing, especially for those taking the medication for high blood pressure. However, if it drops too low, it can cause symptoms like fatigue, blurred vision, or fainting. Another side effect to be aware of is low blood sugar. This can lead to feelings of hunger, irritability, or shakiness. It's particularly important for those with diabetes to monitor their blood sugar levels while on this medication. Diarrhea is another possible side effect of Losartan. While this can be uncomfortable, it's usually temporary. Staying hydrated and maintaining a balanced diet can help manage this symptom. Back pain and cold symptoms, such as a runny nose or sore throat, can also occur. These symptoms are generally mild and should not last long. Remember, these side effects are typically transient and will likely diminish as your body adjusts to the medication. However, if they persist or worsen, it's crucial to contact your healthcare provider. They can provide guidance and, if necessary, adjust your dosage or suggest an alternative treatment. It's also worth noting that this isn't an exhaustive list. There might be other side effects not mentioned here, so always keep an open line of communication with your healthcare provider to address any concerns. Taking precautions can help minimize these side effects. Stay tuned as we delve into the precautions you should take when using Losartan in our next segment. Before you start using Losartan, there are some precautions you should be aware of. This medication, while effective, does come with certain restrictions that you must consider for your safety. Firstly, if you are pregnant or planning to become pregnant, Losartan is not recommended. It can potentially cause harm to your unborn baby. The same applies if you're nursing. It's always best to discuss these matters with your doctor to ensure the health and safety of both you and your baby. Secondly, Losartan should not be taken in conjunction with medications containing aliskiren. Aliskiren is another type of blood pressure medication, and combining it with Losartan can lead to complications. If you are on any other medication, it's crucial to let your doctor know so they can advise you accordingly. Furthermore, individuals with certain pre-existing medical conditions should also steer clear of Losartan. This includes conditions like kidney disease, liver disease, and certain heart conditions. Losartan is powerful and can interact negatively with these conditions, worsening them rather than providing the intended benefit. It's also worth noting that while Losartan can help manage your blood pressure, it's not a one-size-fits-all cure. It should be used as part of a comprehensive treatment plan, which may include a healthy diet, regular exercise, and other lifestyle modifications. Finally, and most importantly, it's crucial to take Losartan exactly as prescribed by your doctor. Do not take more or less of it, do not skip doses, and do not stop taking it without discussing it with your healthcare provider first. Regular checkups are also necessary to monitor your blood pressure and adjust the dosage if necessary. In conclusion, while Losartan is a beneficial medication for many, it's vital to remember that it's not suitable for everyone. Always consult your doctor before starting any new medication and follow their instructions to the letter. Remember, it's essential to take Losartan as prescribed by your doctor. Let's recap what we've learned about Losartan. This versatile medication is primarily used to treat high blood pressure in adults and children over 6 years old. Losartan belongs to a class of medications known as angiotensin second receptor antagonists. These work their magic by blocking certain natural substances that tighten blood vessels. Aside from its primary purpose, Losartan is also employed to reduce the risk of strokes in individuals with high blood pressure and left ventricular hypertrophy. Additionally, it has been found to be effective in treating kidney disease in people with type 2 diabetes and high blood pressure. However, as with all medications, Losartan has potential side effects, including dizziness, low blood pressure, low blood sugar, diarrhea, back pain, and cold symptoms. Precautions must be taken when using Losartan, particularly for pregnant individuals and those taking medications containing aliskiren or who have certain medical conditions. Knowledge is power, and we hope this video has empowered you to make informed decisions about your health. Join with our YouTube channel Explained and hit the subscribe button for more such informative videos.